Hi, thanks so much. I'm Dave Triska. I'm a GP partner down in Surrey. I've been using Accurx for probably about a year and a half, 2 years now, and work as a consultant in my spare time to do some workflow redesign for them. So the idea is trying to show you how all this works together and how you can use it to actually improve practice. So not just for patients, but clinicians as well, because not very good having uh, tools that make your life worse, and certainly you don't want ones that make the practice crash because they're overwhelmed. So it's the big one this year. So triage and same day access. So we all over in terms of both PCN and direction from government. So how do we do it? What's the way that we can make a silk purse out of a sow's ear that is currently the funding for general practice? Well, we can't really get more clinicians. We're not going to have patients contact us less. That seems unlikely. So a end-to-end unified approach to triage, uh, however you wish to call it. It's not my favourite term because it doesn't really encompass some of the complexities that we can now do in terms of that asynchronous consulting. But using computers to do that is possibly one of the only ways that we're actually going to have some productivity improvements in general practice. The problem with our business is that it relies on us being with patients, sitting with them, talking to them. I don't have a time turner from Harry Potter. I can't make the consultation stretch out any longer outside of the allocated time. So there's only certain ways that we can get some of that time back without being able to implement more clinicians. And it's that pre-workup bit that's really important. So this is another one of the flows that we talked about. You're very welcome to have copies if they're helpful. But just again, looking at as a patient enters the practice, first of all, making it so that it's equitable. So both phone and online should be treated ideally the same. So there's no differentiation of workflow. So they go into the same pot, if you like, and then actually utilizing with whether it's your an admin team who've been trained or a clinical team, Flories, self-booking summaries of care that you can actually get them care quickly and get them the right care with the right person for the right amount of time, and sieve off the things that don't especially need synchronous face-to-face or phone appointments. Massive difference to what you're doing. And even if you just think about what a Monday morning your practice is like now, how many phone calls are coming in and how long is spent by whoever's answering those phone calls booking them into appointments that they need, whether or not that's a phone call with a duty doctor or whether or not it's a face-to-face appointment. And then consider what that would be like if that was a simple matter of sending them an SMS with your linked appointments the same day. And it's an enormous difference, and transforms what can be a dreadful job working as duty into something that's actually tolerable. And typically when we manage to get away at 6:30 each duty day, and I'm not saying that's because I'm fantastic at being a duty doctor. I don't think I'm any better than anyone else, but actually utilizing these sorts of tools means that the time I am spending is important clinical time, not just taking histories. The next slide, please. So one of the bits I wanted to just highlight was about the reception side of things, and we're going to show this in the demo in just a second as well. So I talked about utilizing an equitable access for both people who aren't using online compared to people who are using online. And we've generated something called reception flow within the product, which is we're going to show you, but also just looking at it, whichever way it comes in, it's being treated the same way by them. So there's not a bypass of the time that you get to speak to a clinician. If you send it online, it doesn't give you a super special dodge the queue pass. And equally, if you are having to phone in, ideally if people are making good use of online, your phone lines have freed up dramatically. I can tell you some stats from my practice now. So we're a 12,000 patient practice, and we have roughly 500 phone calls a week, which is often what people do within the first few hours of Monday morning. So it does make an enormous difference to it. If you generate those workflows for patients, their incoming phone calls into the same place that the online things are coming into, that's how you get the equitability. It does make a huge difference. But again, treat people the same, use the products to save yourself time, make sure that you can have good clinical conversations with people where you've got enough information to do so. We've all had the 9 minutes, 30 seconds. Right now, I can actually do my job after listening to the history with 30 seconds to go, and you can make that a thing of the past.